Hello and welcome to Timing is Everything, a program of Care Dimensions, formerly Hospice of the North Shore in Greater Boston. My name is Mary Crow, educational specialist at Care Dimensions. Today, our guest is Lilly Sanchez, and she is the Specialty Program Manager at Care Dimensions. Welcome to the program,
Well,
Lilly.
thank you for having me today.
So it's a pleasure. So, today we're going to talk about these specialty care programs. We're also going to talk about telehealth. But before we do that, tell us a little bit about yourself.
Well, my background is in nursing, and I've worked for Care Dimensions for the last 5 years. The first 3 years I worked as a RN case manager, and then for the last 2 years I've worked as a specialty programs manager.
Great. Now you're going to go into the specialty programs manager, but tell us what does an RN case manager do?
It's usually the nurse that visits the patient at home. It's a primary nurse who takes care of them wherever the patient is.
Excellent, excellent. So tell us about these specialty programs.
Well, most patients, when they think, or people in general, when they think of hospice, they think of cancer patients. But mostly, also, we have a range of patients that come on to hospice with congestive heart failure or COPD or the chronic obstructive pulmonary disease. So we've developed these specialty programs for these patients so that they can have better care at home.
Excellent. Yeah, and you're right, because again, and we've talked about this on the show, that really people do have this, and we've talked a lot about myths and misconceptions, and one of them is that, again, hospice is just for individuals who have cancer, but there's so many other, really, hospice is really open for any patient with any advanced or life-limiting illness. But again, you're talking specifically today about cardiac and respiratory disease, which is great. So tell us a little bit more about these programs and how they work.
Well, mostly the cardiac and respiratory program was developed for patients that want to have more care at home, more specialized care where they're not going to the emergency room or they're preventing some hospitalizations. So they were developed about 5 years ago so that we can provide this wonderful care for the patients that they want at home without having to have that extra visits to the hospital.
Excellent. So go into more detail about each of the programs. Break it up for cardiac and for respiratory, and really break it down as to how these work.
Well, for the cardiac program, what we do mostly is for patients who either have atrial fibrillation or coronary artery disease. And these patients, what we do for them or how we manage them at home is that we give them a daily phone call. And we have a liaison that calls them. It's a confidence liaison. And she calls them and she finds out their weight, if they're having any changes in their vital signs. She also looks for different symptoms that we've been managing, like if they have swelling to their legs or if they have any other symptoms that they might report or changes in medications. And it just gives the patient the opportunity to say anything that have been different for them. And then in the case of the respiratory program, we're also looking for the same kind of symptoms to see if they have some shortness of breath, or if they have any sputum changes, or if they're using more oxygen, or if any of their needs have changed in that period. We may also monitor them with using the telehealth, like I said, and that's a remote vital check that we do for them, for the patients, for both the cardiac and the respiratory program.
Yeah, and I'm going to ask you more about that too, telehealth, in a little bit. But it's always interesting because, again, these are big things. Because again, certainly, as I've mentioned before in the show, the majority of the people that we do care for, about 38% have a cancer diagnosis, but still cardiac disease is up there, and again, respiratory it's a very important thing. And these are unique in a way, aren't they? Because again, patients and families, there's some concern around whether people want to be at home mostly. Not all, but again, it's wherever the person calls home, but it's hard for them sometimes to do that, particularly with some of these diseases where there's increased anxiety and stress levels. What do you find with that?
Yeah, we find that the phone calls that we do for them daily are very helpful because they feel they have someone that's calling them, that's there for them on a daily basis. So it reduces their anxiety level. It also helps the nurse that's caring for them because they know ahead of time what's going on with the patient at home. They know if there's any changes or if they need to visit them for their day, to change medication or to do any kind of symptom assessment that the patient may have. So they're very happy to be
bet.
called on a daily basis,
Yeah.
especially on the weekends sometimes when the nurse is not visiting.
Sure.
That way they can talk about their symptoms. They can have like an extra set of eyes calling them every day.
Which is really wonderful, because again, you know, one of those other myths and misconceptions about hospice care is that hospice is 24/7, but we know that that's not true, that it's really interim care. And again, you know, so that there are visits from nurses, social workers, chaplains, volunteers, other team members, hospice aides, etc. So with this program, this is really beefed up. This is wonderful, because again, with these sort of symptoms, there can be a lot of anxiety or worry about, can I manage my loved one, or can I manage in my own home? So those daily calls are must be extremely critical.
They are. And then one of the other things that we do for some of the patients is that we have that action care plan where they sit one-on-one with their nurse and they discuss what symptoms they would be calling us for, and the other goals that they have in their care. How much weight are we managing, if it's 1 pound, 3 pounds, 5 pounds. And we work together in the community, not only with their primary care doctor, but also with their cardiologist or their pulmonologist or any other provider that may be involved. We also liaison between everybody.
Yeah, so that's important too, though, because again, sometimes I keep going back to these myths and misconceptions, but I can't help but do that because, again, there's still such a lack of understanding sometimes around hospice care. Sometimes physicians even think, or the patient and the family, that once hospice is involved, that the physician is out of the picture. But you're telling us something very different here.
Correct. Yeah, we have a very close communication with any doctor that the patient is involved or participant is involved.
Yeah, which is so important again, because in terms of that continuity of care, so the pulmonologist, the cardiologist, because sometimes, again, what we want to avoid is this division, right?
Correct.
This division in care. So it sounds like there's really good communication.
Absolutely.
So do our physicians call the cardiologist and the other physicians as well?
On occasion, they communicate with each other to
Yep.
have a plan of care for the
Yep.
patient, which is very important to continue that
Yeah.
talk between doctors.
Yeah, and that again is somewhat unique too, just in terms of, and we've talked about that, just the number of physicians and nurse practitioners we have on service, which is really wonderful, because again, we certainly understand the need to do that more to physician, you know, conversations sometimes around the patient's needs and such. So it sounds like there's a lot of enhanced communication. How important is that when it comes to, again, caring for people with cardiac or respiratory disease?
Yeah, it's very important. And one more thing that I like about the programs is that we have the Kaplan House available if they are having some symptoms that we can't manage at home, that the nurse has gone out, they've tried to adjust their weight, they've tried to adjust other symptoms or more oxygen or other things the patient may need. At that point, we may transfer the patient for a little bit to Kaplan House so that we can do some symptom management there. And we've had many patients come. They have a great experience because their symptoms are being managed at Kaplan, and they're there for 3 or 4 days, and then they go back, versus having to go through that process of going to the emergency room, sitting there for 5, 10 hours,
Yeah.
waiting for a bed, and then, you
Right.
know, things that we could have done in the patient's home.
Yeah. Now, again, that's important too, because people sometimes think that, again, going to the Kaplan House is just for people who are really at the very end, but it's not at all the case. We're really talking about people who, again, are going there really for that symptom component, that management piece, and then they're able to go back to where they want to be, where they call home. So that's a nice feature. So do you find that many people do that?
We have a good percentage of the participants do that when we need to.
Uh-huh.
But our goal is mostly to manage them at home. This is just an added level of
Yeah.
care if need to.
Excellent. Yeah, it's nice to have, again, because sometimes, again, people are worried. They don't want to go back to the emergency room, right?
Yes.
They don't want to be
They don't.
hospitalized. And it's how important is it that people's wishes are addressed in this way?
Yeah, it is. It's very important because I find that most of our participants have gone to the hospital 5, 6, 7 times before they come onto hospice and then onto our program. And by doing this, they feel like, well, I'm supported. I can do this at home. I don't have to go to the ER or the hospital, and I could just call my nurse and she'll be here. Plus, I have someone calling me every day,
Yeah.
so that helps them as well.
Absolutely, which is really nice again. So I'm not going to put you on the spot in terms of specific numbers, but again, tell me in terms of, have you seen with the program being in place? You said 5 years now. Have you seen outcomes in terms of decreased emergency room visits and hospitalizations as a result of these programs?
Well, absolutely. Last year, we had patients in the respiratory program be 100% of the patients that were under our care stayed in our care for the length of stay.
Wow.
So that's a fantastic number. That was with the respiratory program.
Yeah.
And then with the cardiac program, we had 90% of the patients be able to stay home with care.
Wow. So those are big numbers.
They are.
So again, clearly these programs have been extremely effective.
Yes.
Oh, that's great. That's great. So tell us other components of the program that we haven't talked about yet.
We also have the telehealth component to the program,
Yeah.
where it's a remote device that we bring into the patient's home, and we're able to monitor them this way as well.
Yeah.
We monitoring their symptoms, and we're monitoring their vitals, and it's all wireless into the patient's home. So a lot of times they feel like, okay, what is all this technology coming into my house? But as you know, Mary, more and more people are doing the technology
Right.
way of doing healthcare, and this is also part of where we're introducing that into the cardiac program and the respiratory program, so that we can monitor the patients, and hopefully we have a good grasp of what their vitals are. And I think it's beneficial because a lot of the patients sometimes are forgetful when they take their vitals at home or
Sure.
they take their weight,
Yeah.
and they can't remember.
Yeah.
But with this program, they just get on the scale and it automatically comes to us.
So all of that, so this is equipment, again, that we actually put into the home,
Yes.
right? And then it monitors, say it again, in terms of if their weight.
It manages their weight, their oxygen saturation,
Yeah.
their blood pressure,
Uh-huh.
and their pulse.
Wow.
Yes.
Oh, that's great. So, again, because some people do get a little shied away around technology, but this is stuff that, again, is really self-sufficient and that we're actually overseeing, so they don't have to worry about that piece, right?
Yes.
So, we'll talk about this too, just because some people worry about, oh my gosh, what's the cost to that?
Yes.
So, what's your answer to that?
There's no cost.
Right,
It is
okay.
covered by
Yeah.
Care Dimensions and their benefit.
Yeah. So, which is again important because people worry. They have enough to worry about in terms of just, again, trying to live life fully with an advanced illness so that they don't have to worry again about, some of these other components like the costs associated and things like that. I'm going to ask you a few more questions about telehealth when we come back, but, we're just going to take a quick break and then we're going to come back and I have some more questions to ask you about this program.
Thank you.
I have worked in a lot of different settings, and I have never seen the care, love, and support that I've experienced with Care Dimensions.
Because it's about the patient's quality of life.
We provide care during one of the most challenging times in a family's life.
One of the things that we really focus on is how people want to live their life.
We have transformed the way our community experiences end-of-life care. It is more than hospice. It is care for advanced illness.
At Care Dimensions, we'll take care of your family like you're a part of ours.
Welcome back to Timing is Everything. Today we're meeting with Lilly Sanchez, who is the Specialty Program Manager at Care Dimensions. We've been talking about specialty programs today. We've been talking about the cardiac and the respiratory program that you oversee at Care Dimensions, Lilly. So this sounds great because, again, I think it's so important that people are able to know that there are some unique challenges and differences with particular disease process. And again, I talked about this a little bit with you earlier. There's a lot of anxiety that goes along with respiratory disease and cardiac disease sometimes, and how important is that in terms of helping people maintain themselves at home?
Yeah, it's quite important for the patients and mostly the families too, because they're anxious about around the fact that they're now responsible for taking care of the patient, and they were used to just saying, I'm going to call 911 and 911 will take care of my family member, and it was that running back and forth to the hospital. But now that they have Care Dimensions on board, they're able to feel the confidence of caring for their loved one at home by being in this program.
That word confidence is critical here, right?
Yes.
So, and I've heard you say it a couple times, so I just want to come to this for a minute, because it really is about confidence. How do we help family members be family members too at such a critical time, right? And also because, again, it's so hard sometimes when you're a caregiver, you're not getting to do all of the other things that are important too in terms of having time with your loved one. So I like that word confidence, because again, we're thrown into caregiving sometimes, aren't we? We're not prepared, we're not taking a class, and then here we are and our loved one has, advanced cardiac disease or respiratory disease, and we don't know what to do. So talk more about that too in terms of that confidence, because you brought that up a couple times.
Yeah, so what we do is we want to have that one-on-one education
Yeah.
with not only the patient but also the caregiver, so that they can have a good plan of action, a good care plan for the patient, that they're both on board with what the patient wants, the patient's wishes to do. And like you said, they want to spend time with their grandchildren, they want to spend time with their loved one. And when they have a team of people behind them, an RN case manager, they have the social worker, the chaplain, they have a team also in the office who's looking at their vitals and calling. They feel like supported this way, so they feel like, okay, this is good, I can do it, I can call Care Dimensions for whenever symptoms change. And we have those calls. They're calling us saying, my mom is more short of breath today, or they tell the confidence liaison, my mom or my dad doesn't feel good today, she's different than yesterday, and they feel more confident to have that. And it's the same person calling them every day, which is nice.
Continuity too.
So they have that kind of continuity of care.
Very nice.
Which is lovely.
So there doesn't have to be that panic to 911. It can be, I know who to go to here. I can call, and I know that, again, I'm going to be able to report these symptoms. I'm going to know which direction to go in. And if necessary, I'm going to have somebody out there, right? Because that's a key piece to this too, right? Because you're talking about, certainly the team visits and then the calls, but people would get out there if necessary.
Oh, absolutely. And a lot of times patients may not feel like, oh, this is something I should report, but because they're getting that call every day, they're telling her, or she's asking them, like, how was your night, and how was your, did you sleep okay, or those kind of things. And then little things come up that changes the whole picture in their health care, and she automatically reports it to the nurse. Either the nurse will respond either by a call, calling them back, or by visiting the patient or having the support needed out there.
Excellent. You brought up something important again a minute ago. You were talking about, I think that sometimes when people are dealing with, one of these more long-term illnesses, that sometimes they think it's almost becomes commonplace to them and they don't even think of reporting certain symptoms. So I think that that's another component too, right? In terms of people bringing to an awareness, they might not even think of saying that, oh, that, I have that every day. Geez, I'm short of breath every day, you know? So how do you help with those sort of things?
Well, asking them, how is your shortness of breath today? Or sometimes they say, well, you know what, yesterday I was able to go get my lunch, but today I wasn't able to go that far. So this is when she's reporting those symptoms every day to the nurse, and the nurse can see that, oh, well, yesterday they were able to walk 500 feet, now they're only able to walk about 450 feet. So there's a little change there. She might have that talk with the patient where it's like more education, more oxygen, or whatever other needs the patient has.
Well, isn't it interesting how you have those conversations and it's not always directly, is your shortness of breath worse? Yeah, like you said, yesterday I'm able to walk and I can get my lunch, today I can't. So sometimes it's almost, it helps in terms of measuring that.
Correct.
In terms of those sort of questions that sometimes you don't even think to ask, but you guys are trained in that way to do it. So who
Absolutely.
qualifies?
Well, it's mostly anybody that has a chronic cardiac condition.
Okay.
It could be that they have congestive heart failure.
Okay.
They can have coronary artery disease.
Yep.
They can have atrial fibrillation. Just pretty much the whole array of any cardiac condition.
Okay.
That's the patients for the cardiac program.
Okay.
Patients for the respiratory program, it could be a COPD patient or a chronic obstructive pulmonary disease.
So that's what COPD is.
Correct.
Yeah, just for people that haven't heard that term, COPD, before. So
Yes.
go ahead and.
Also, patients who have emphysema
Okay.
or bronchitis
Yeah.
or asthma
Okay.
patients can benefit from this program.
Excellent. Yep. So and so they would be on hospice services.
Yes.
In order to partake in the program.
Yes.
Right. Because sometimes I've heard people say, "Well, I'm going to call and get on this specialty program," but they're not even thinking that really they're really coming on to the hospice benefit.
Yeah, it's actually a
Yeah.
benefit from the hospice
Yeah.
from the hospice.
Excellent. So those are the people who become eligible. So tell us some other benefits too. Some of the other things that the programs really enhance for patients and families.
A lot of it is education, I
Yep.
think, for these patients that we're, doing the phone call. That we're also educating them when we're calling them on the phone.
Yep.
Some patients are like, "Oh, my feet are swollen," and automatically the confidence liaison is saying, "Can you elevate your feet? Did you take your medicine?"
Yep.
That's another component of the benefits that we're reminding them
Right.
to take their medicine a lot of times. Because they're like, "Yeah, I put it on the side. I'm going to take it with my lunch." And then sometimes they forget.
Yep.
So that's an added benefit to the program.
Absolutely.
Also, like I said, if they have symptoms that they're not being well managed, we can have a nursing visit or a chaplain visit sometimes
Sure.
with the anxiety or any other thoughts they may have
Yeah.
that they benefit from that. Or sometimes she calls and it's like just talking about the past, just having that kind of emotional component to the program as well.
Yeah. Well, and again, you're talking about, elevating feet, you're talking about just conversation. That sounds like even distraction, that sort of thing in terms of refocusing and all. So it's not, because sometimes people think just the medication piece, but there's actually non-pharmaceutical ways that we're educating in this program, it sounds like. Can you talk some about those?
Yeah, we have an actual patient handbook, patient and caregiver handbook, where we educate them not only on non-pharmacological things they can do, but like on the cardiac program handbook, there's a whole section about diet and how to read the labels, because those can be confusing.
Yeah.
What's one serving? What's two servings? How much is sodium? So those kind of things are in the patient handbook that we're able to sit down and if they have questions about it, go over it. Also in the handbook, there's a list of potential medications the patient may be on, what their side effects are, what they do. So that's another added piece to that education that the nurse may do with both the patient and the caregiver. And then the education piece on the respiratory book, it's more how to use sometimes the oxygen, how to use their nebulizer machine, how to use their inhaler. Because sometimes you go to the doctors and he's like, "Here's an inhaler," and automatically we think that everybody knows how to use one. But this book also explains how to do those kind of things, or relaxation techniques so that you can get your breathing controlled, and supplemental oxygen and those kinds of things.
Which I think, again, those are as critically important, because it's just a vicious circle sometimes, isn't it? When you have respiratory disease, you get anxious, and then, it's hard to, and then that exacerbates your respiratory disease. So some of these relaxation techniques and all, even, and like you said, breathing techniques, that sort of thing, we take for granted that people know how to do these, but they don't. And how they can, again, not get into that panic of calling and feeling the need to call 911 when, again, they could be comfortable in their own home and help to kind of be more calming and addressing these symptoms and issues.
Correct. And they feel good because they know what to do on those moments of panic, what we'd call, when they are having that, what we call the dyspnea or shortness of breath cycle, where they're short of breath and anxious and short of breath because they're anxious. They know what to do. They know to call us, and they know that someone will be there in a short period of time.
Yeah, that alone can decrease anxiety.
Yes.
Right? So there's that confidence thing again, right? Because
Yes.
again, having the confidence that you know who to reach out to, and again, I think that this would be really a confidence builder again for the family as well, saying, you know, look, we have direction, we know where to go, you know, we can kind of get a handle on this, and it's nice again for the patient to be in wherever they want to be in terms of home.
Yes.
So let's just talk for another minute about this telehealth. Okay, so you're talking about, again, this system that goes into the home. You already mentioned that, again, even though it is more technology, it's not threatening technology to people.
Absolutely not. It's a very small device that we bring in the home. It also monitors the blood pressure and the oxygen level and the weight. So this little machine automatically, without having to be wired, just monitors everything, and it sends it, transmits it to the office where a nurse is looking at those vitals on a daily basis. And it also asks them a little survey question of their symptoms. How did you sleep last night? Did you use more oxygen? Did you have to change your sleep arrangement?
Wow.
And those kinds of things. And the
Like
nurse,
sitting up in a chair sort of thing?
correct.
Is that
Like
what
sometimes if
okay.
you had to use more pillows to sleep,
Yep.
those are little tail signs
Yep.
that the patient may need help.
Yep.
Or they're building fluid in their
Sure.
lungs or in their legs.
Yeah.
So we do that by monitoring that, and the nurse in the office gets that. And if she feels like the patient needs a phone call, she'll call them.
Wow.
Which is really amazing to me that we can have all that
It is
information
amazing.
wirelessly
Yeah.
from their home into our office.
It sounds like a great system. So, you know, we only have just a very short time left, but is there anything else that you haven't said that you just want people to know out there before we wrap up?
Well, I just think that don't be nervous to participate in these programs. They're fantastic. They're there for support, to prevent you from having to go to the emergency room, to go to the hospital, that you're at home, you're with your loved ones, and that you have a big team of people behind you.
It's wonderful, yeah. Well, thank you so much for being on the show today and sharing your expertise. And, you know, if people have other questions in terms of questions around specialty care programs, please feel free to call our main number. You can speak to Lilly Sanchez, or you can also look up on the website and get more information on the program. Thanks for tuning in today, and we look forward to you tuning into the next program.